We have a very, very full agenda today. This is going to be a bit like speed dating on Zoom. We know that everybody has a little bit of Zoom fatigue, so this is an hour-and-a-half event. And aside from our keynote speaker, Jim Firman, and our technology presentation, no one is going to speak for more than 5 minutes. I'd like to begin by introducing the chairman of our board, Dave Melton. Dave comes to us from Liberty Mutual Insurance Company, where he worked for, I believe, 45 years and worked on safety research. So he's going to get us going here. Thanks, Dave.
Thank you, Catherine. I'm really glad to be here. Warm welcome to everyone for joining us. On behalf of everyone with the organization, this is our third annual Philanthropic Collaborative for Rural Transportation. The purpose of this event is to bring together foundations, businesses, and organizations to support a shared platform for community-based nonprofit transportation. While every community is different, every community needs good technology and a solid support system. We would like to thank the Consumer Technology Association Foundation, which has not only supported this work, but also has co-hosted the Philanthropic Collaborative for 3 years. We also want to thank the Harry and Jeanette Weinberg Foundation, the Next 50 Initiative, Salesforce, Esri, and the U.S. Department of Transportation. I'd like to thank all of today's speakers and our moderator, Laura Lee, Director of Grant Making at the Maine Community Foundation. I'll now turn it back over to Catherine.
Thank you, Dave. I'm going to just begin by telling you about ITNAmerica's mission. We promote lifelong mobility for older adults and people with special mobility needs. We support sustainable community-based transportation by leading a national network grounded in research, policy analysis, and education. So a word or two about the size of the issue. Many of you are familiar with this, but it's always worth taking a minute to restate it. There will be 70 million Americans over the age of 65 by 2030. People outlive their decision to stop driving by a decade or more. And most older adults live in rural and suburban communities that lack the density for traditional transportation solutions. So it's a national problem, it's a large problem, and it is growing by the day. ITNAmerica has been working on addressing this problem for 27 years. And in that time, we've done a number of things. We developed the original sustainable ITN model with all of its innovative programs, Trade Your Car for Rides, credits for volunteer drivers, ITN Rides technology development with its personal transportation account, where I guess now it's called an electronic wallet, but we've been doing it for a very long time. We've delivered 1.4 million door-through-door and arm-through-arm rides. We've built and sustained a 178 field database of everyone who uses ITN in any form for transportation. We've built Rides Insight, which is a database searchable online, free to the public, of all transportation in the United States. We've developed the training program in the cloud called the Community in the Cloud through the Online Learning Center. And we are soon going to be working on America's Volunteer Driver Center, which is a way for people anywhere in the United States to volunteer to drive for the transportation service in their community. So this is a lot to do, and most of it has to do with technology. I think that technology is really the great opportunity that we have to bring support for community-based volunteer transportation to any community, any organization in the United States, and to do it at a very, 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 very affordable rate. That's incredibly important because nonprofit community-based services are not affluent. So this is actually what's called a digital transformation. And to make this happen, we need participation from all three sectors of the economy. For ITNAmerica, we've been working with Salesforce and Esri from industry, with the Federal Transit Administration, the U.S. Department of Transportation, and the CDC from government, and from philanthropy, as Dave mentioned, the Harry and Jeanette Weinberg Foundation, the CTA Foundation, and the Next 50 Initiative. And you're going to be hearing a few words from those organizations very soon. So how far have we come in this collaborative effort to bring everybody together to fund a good technology platform in the cloud for communities? We've raised $2,770,000 so far. The next question is, how far do we need to go to complete the technology? And we're in the cloud now, but to add all the pieces that we need to make it really, really, really every bell and whistle, we need another 500,000 from technology, from philanthropy. And it's very important that philanthropic support be used for technology development. And Jim Firman will say a few words about that when he speaks. But we also are looking to the philanthropic community and to the government for jumpstart grants to help communities get started and get onto the platform and be a part of a national network. Every community doing their own thing, but supported on a national network. That's the vision. So today, during this very fast-paced speed dating for Zoom, we're going to start at a very high level and talk about scaling and technology and why that's important. And then we're going to move very swiftly to hear a few words from the foundations that are currently supporting this effort. We're going to see a software demo, and then we're going to go to the transit frontier to hear from people in communities who are actually doing the work. At the end of this event, we'll have an opportunity to answer questions. So please keep in mind that you can submit questions, but we will be answering them at the end. So I'd like to say a few words to introduce Jim Firman. I call him the godfather of benefits checkup. Jim's the co-founder and chief innovation officer at Bel Age, which is a social enterprise that harnesses the power of artificial intelligence and emerging technologies to empower millions of older adults across the world to age well. Jim is well known as the former president and CEO of the National Council on Aging. During his tenure at NCOA, he developed the now famous benefits checkup, which is technology. It's an online tool for consumers and professionals, and it has helped more than 9 million individuals find more than $35 billion in benefits. So, Jim, thanks very much for joining us.
Thank you. It's a pleasure to be here. Let me get my hold on one second. I have to stop and get really delightful to. Can you see this? Everybody seeing this okay? What do you see? Do this one more time. Bear with me. You know, you get to be 70. Sometimes it takes a little longer to get the basic things. Good. All right. I'm really thrilled to be here for lots of reasons. I've admired Catherine and her work for many years. And it's very clear that ITN is addressing a critical national problem, but it's inspiring to be hearing from people who have a compelling vision, strategy, and all that they've accomplished to date. What I hope I can do in a few minutes today is share with you some of the lessons that I've learned and insight from a few of my successes and many failures in trying to scale innovation. I've had very painful learning, but I also kind of believe that failures aren't failures if you learn from them. So hopefully this will be cathartic, and some of the mistakes I've made in the past can be avoided by others. So as I think about my scaling strategies, approaches, experiences, I'd like to talk about 3 of them. The first was when I had a full head of hair back in the early 1980s. I had been a project officer at the at the National Council on Aging, and I got recruited to cover the work for the Robert Wood Johnson Foundation to really be their first program officer in the field of aging. And I came to that with a strong bias from NCOA, a belief in the private sector and the voluntary sector and the importance of nonprofit organizations having a seat at the table in each community. And I teamed up with a wonderful gentleman, Terry Keenan, and we convinced the powers to be to fund something called the Faith in Action Program, which began as 25 faith-based interfaith coalitions in 1984. And then later, after I left, Paul Jelinek, the program officer, became involved, and he saw the vision of creating these in many more communities. So between 1993 and 2003, Robert Wood Johnson spent over $70 million and funded 1,500 plus community-based volunteer programs. Today, somewhere between 20 years and 40 years later, depending on when the first project was started, more than 950 or probably over 1,000, about 2/3 of those programs are still going strong with 350,000 volunteers serving 500,000 people annually. These programs have sustained themselves through a hodgepodge of funding because they are deeply rooted in their community. On the other hand, some less important lessons learned have come from this. One is, as obvious to everybody here, there is no such thing as a free volunteer service, and a really good volunteer service is very cost effective, but maybe costs half of what a commercial service would. But even after all this time, the caregiver program never solved for the funding infrastructure necessary to support growth and technology. So cautionary tale that you can invest a lot of money, but if you don't invest in infrastructure and technology support, you will be limited in your growth. The second thing that I was involved with was the benefit checkup. And first developed in 1988 when I was at the United Seniors Health Cooperative with $18,000 in funding from the Harry M. Greenstein Foundation in Baltimore. Those were the days of DBase-3, floppy disk. Whenever there's a change in eligibility program, we had a mail-out disk, and we were sustained primarily by funding from philanthropies in Chicago, Baltimore, Colorado, California, and out west. In 1996, when I moved to NCOA, the benefit checkup came with me, but there wasn't any national funding available then, so we were still locally sustained through these community-based efforts. In 2008, we succeeded in getting funding through the Medicare Improvement Patient Protection Act, which funded not only the technology, but funded health insurance programs, AAA, area agencies, and ADRC to provide benefit support. It included a National Resource Center for TA and technology. And currently the program is funded at the level of $50 million a year out of the Medicare Trust Fund, which is very artfully written legislation, which includes $16 million for the National Center. And the latest numbers I've seen are that more than 10 million people have been served and $8 billion in programming. And I just see that NCOA released a new release of the technology just in the last couple of weeks. The third one is a more painful lesson, but when I left NCOA, we developed a new technology, the kind of a benefit checkup on steroids, designed really to focus on COVID. It was funded by 4 states, 1 foundation, and 1 retiree. It was a painful lesson. We successfully demonstrated that we could do the work and that we could help people make decisions. But we were frustrated because we only reached 75,000 people when we wanted to reach 75 million people. And we learned a lot of painful lessons about what not to do in forming our future work. So as I think about what these things have taught me, is that a couple of things. One, it's not really possible to achieve nationwide social impact and scale without technology. And when we're talking about a solution for low income and marginalized population, it's not going to be solved by the commercial sector. And unfortunately, government does a pretty poor job of driving innovation. And so it takes organizations like ITN and leaders such as Catherine, who have the vision, the commitment to stick it out. And we also need this leadership because the solutions need to be tri-sector, but that leadership needs to come from the private nonprofit organization. The key elements, in my view, of success are that we need the nonprofits to take the lead in developing and owning the technology solution. One of the most important things we did was make sure that the government did not own the benefit checkup. We built it first and then went to them. They would have screwed it up. I've seen the government screw up at least 7 or 8 different attempts at the state or federal level to do things like what we've done. They all think they can do it better, but they can't, and it gets subverted, and the purpose comes from helping people to command and control. So it's essential to take this approach of the philanthropy supporting private sector ownership of the solution. We also, nonprofits have to develop the proof statements, and they need to build the ecosystem for change. And then at the end, I believe we also need to advocate for government support for scaling. Private foundation support is essential. There cannot be success for benefit checkup. There would not be success for the work that ITN is doing without your support. And this support is both support of technology, support of the proof of concepts and evaluations, I'll come back to that, and the seed funding for local projects. If you guys don't play, we can't possibly succeed. And I believe, depending on the goal, but if the goal is rapid nationwide scaling to solutions that address market failures, such as this one, we need to recognize that we will need government support at some point, not necessarily to get to break even, not necessarily to have a sustainable enterprise, but will be, I believe, necessary if we want to help and reach people in every community in America. So the keys for us in this of succeeding was, first of all, don't be seeking support just for the technology, because the technology won't solve the problem. The technology is an essential piece of the puzzle, but as we know from these experiences here, it takes community-based organizations, local government, local nonprofits, local philanthropy, and what we need to be advocating for, and particularly go to state and federal legislative solution, is we need support for a solution. Including in it is a piece of it for technology, including in it probably technical assistance and training, but it's not enough just to try to sell the technology. The second thing we learned was that you have to be opportunistic. You never know when the opportunity, the moment's going to come, although in this case, I believe it's probably going to come in the next 2 years, to get federal legislation, because there's so many things swirling around now. The need for long-term services and support, the need to support caregivers and transportation infrastructure, that whatever solution we come up with here, whether it's $5 million, $10 million, $25 million, that's up to Catherine and her team, it's going to be a rounding error. It's going to be something so small in these budgets that we just need to be ready when the moment strikes and say, here's the proposed language, here's the solution for you. It also, as we were able to do at NCOA with great leadership from Howard Bedlin on the policy side, and I see Wendy Zanker, who was my colleague at NCOA with me at the time, we were very strategic in targeting key legislators in the Senate and the House, Republicans and Democrats on the Authorizing and Appropriation Committee, and making sure we had projects in their communities. That really, I think, can be very effective. And the other thing that was very effective for us was demonstrating statewide potential. Going to Wisconsin, where we had a program that worked, and then telling then Secretary of HHS, Tommy Thompson, how we were really taking his model that he can take credit for nationwide. And then the last part is that we have to be very careful in designing what government support looks like, because government can screw it up. They can oftentimes create rules and regulation which will shackle tri-sector engagement rather than encourage and unleash it, which is necessary in this case. So in summary, there are 3 types of philanthropic investment that I think are needed. The first is in technology, and I want to give a special shout out to the Weinberg Foundation, because I think they made one of the most significant changes in funding in the field of aging when they redefined what capital investments were from bricks and mortar to technology. I think this was a brilliant move and one that really is allowing organizations such as NCOA and ITN and others to really invest a source of investment that wasn't there before. I also want to give a great shout out to Mackenzie Scott, because I think what she's done in terms of looking for organizations from providing unrestricted support is essential. And the thing about technology, though, Catherine needs $500,000 to finish her technology, and that's great, but she's also going to need money down the road to take advantage of AI and machine learning and all the technologies that are going to happen. So we have to realize that investing in technology is probably the most cost-effective thing we can do. Local projects of national significance are something that every funder in this room can do. When you fund to seed a project, whether it's demonstrating, reaching a different population, testing it out with a different organization, developing more of a proof statement, making something happen statewide, every project that you do should be done with the lens of not only how do I help my community, but where's the contribution to the national scene. And that's really not hard for somebody like Catherine to identify how what you do can have greater significance, but being intentional about that is important. And finally, also being intentional about the real power of philanthropy is not just the money, it's the convening and leveraging ability for you to bring other people, government, foundation, other organizations together to work together toward these transportation solutions. So I wrap up just only to say that I'm not retired. I've continuing to build on my different experiences I've had to really work on using artificial intelligence and emerging technologies to help people age well. And I really do think of this as my capstone project. But the last part of my capstone is really just taking what I've learned and being able to help great leaders like Catherine to further their work. So thank you for the opportunity to be here. I believe that we are on the cusp of a solution here and a scalable solution, and the time is right, and the moment may be sooner than we think. So your investment now is essential.
Thank you very, very, very much, Jim. Words of wisdom, I think. And for those of you who have questions for Jim, please feel free to submit them and we'll take them at the end if we can. And if not, we'll be sure to get back to you on them. So I just want to also introduce Laura Lee and thank her for taking time from her busy schedule to join us today. Laura's the Director of Grant Making with the Maine Community Foundation. And she has worked for years with dozens of communities in Maine to support nonprofit volunteer transportation at the community level. Through Laura's leadership at the Maine Community Foundation, some of the first small grants to explore the ideas that are now developing nationally for ITN country were able to come about. So thanks very much for joining us, Laura, and I'll turn it over to you to introduce our next speakers and our panel.
Thanks, Catherine, and good afternoon, everyone. I know from personal experience at the Maine Community Foundation that there are many good causes to fund and that foundations receive many more requests than they can possibly fill. Our first panel has 3 speakers from foundations that have decided to fund technology development for transportation, and they're going to say a few words about why their foundations chose to collaborate on one shared application for many communities. Our first panelist is Earl Millett, Program Officer of the Harry and Jeanette Weinberg Foundation, where he helps to manage grants in the area of health. Earl has extensive experience in various leadership roles in nonprofit community development. I'll turn it over to you, Earl.
Thank you so much. It's an honor to be able to speak before a group of people all working hard towards helping older adults. And nothing exemplifies that more than ITN and getting transportation to connect older adults to the services that many of you provide, and everybody's working towards and making that connection. Jim did also speak already to the trustees' foresight many years ago. Harry and Jeanette Weinberg passed away over 30 years ago at this point. And when they set up the foundation, they knew capital, bricks and mortar, which we still do, housing was crucial and important to kind of set a place where benefits for older adults could be built. The first grant ever that Harry Weinberg did in a grant type sense was bringing air conditioning to an older adult home in Israel when he discovered that they didn't have air conditioning in the place. So it's kind of at the core and the foundation of what the foundation is. But it was relatively recently that the trustees recognized the need to include technology in that, because it could spread throughout the country, as in the case with this grant, and really be an example of providing those services. But while it is something, this technology that is capital that will be around for a while, that will build and help many organizations get access and provide access to older adults for the services they need. And that's important. And that's why certainly the Weinberg Foundation funded it. I think what ITN and this program is able to provide that doesn't get talked about sometimes as not enough is the social isolation prevention, the real one-on-one personal contact with older adults. We don't think of technology as personal contact. We don't consider it the friendly touch, but this is technology that allows for that to happen. And really, we wouldn't be interested in supporting something that didn't meet the individual older adult, whether it be from Maine or to Hawaii, unless it was meeting them where they needed to be at their house with an individual who can then check in on them, know that they're doing okay, connect them up to the specific services and benefits that they need. And that's what's made us excited to be a small part of what ITN is doing, and really just proud to be a partner with the other foundations who can combine those resources with even more federal dollars, government resources, because philanthropy, all of us know we can't do it alone. We can just be that piece to help get us to where we need to be, which is being able to connect with every older adult in this country, and really, in our case, in some cases, internationally. So thank you for the opportunity to speak to all of you. I am happy to meet those that are listening to the presentation, and please feel free to connect up with me after this if there's any specific questions that I can answer, but it's really just a privilege to learn more from all the rest of the panelists. So I will turn it back over to you.
Thank you, Earl. And next panelist is Steve Ewell. Steve is the Executive Director of the CTA Foundation, the charitable foundation affiliated with the Consumer Technology Association. The CTA Foundation focuses on convening key stakeholders, promoting innovation, and funding nonprofits using technology to enhance the lives of older adults and people with disabilities. Over to you, Steve.
Great, thanks, Laura, and great to join everyone here today. Just really thrilled to be part of this conversation. As Laura was sharing, the CTA Foundation, we're tied to the Consumer Technology Association, which is a trade association representing the technology industry. And we launched 10 years ago as a way to give back on behalf of the industry and focus specifically in on how technology can help older adults and people with disabilities. So when I met Catherine at actually a Grantmakers and Aging event focused around transportation a number of years ago, it seemed like a really incredible fit with what we were looking at doing with our mission. As anyone who knows Catherine, she grabbed on and asked if I would host a group of people at our offices in Arlington, Virginia, just to start talking about the work that we're doing. And I was thrilled to be able to host that meeting back in 2019. And based on what I saw there, we decided to come in and fund in 2020 and 2021, and just renewed in 2022. So we've been really happy with the work that we're doing, seeing the companies that she's engaged, seeing the other foundations that are supporting. It really goes to show the impact that an organization like ITNAmerica can have on older adults across the country. So we're just thrilled to be supporting and here with our peers and colleagues in doing this work. So thank you for having me.
Thanks, Steve. So the next panelist is Susan Hill. Susan is a program officer at the Next 50 Initiative, a grant maker located in Denver, Colorado, whose focus is improving the lives of older adults. Susan has 30 years of experience in public health and philanthropy. She has a particular interest in supporting community-based efforts to address the needs of traditionally underserved populations. Susan?
Hi, thank you. Well, thank you for inviting me. This is very exciting for me. I think that we must be ITN's newest funder. This grant was just awarded, and Next 50 Initiative is a new funder altogether. We will celebrate 5 years of grant making this fall. And our focus is on older adults exclusively. So we define that as being people 50 and older. We don't narrow our grant making any more than that. The grants have to serve older adults, but we don't have particular topic areas, at least yet. We're young, we're growing. But we have been a responsive grant maker for the time that we've been in existence. So we try to look at grants that support community identified needs for the older adult populations that organizations serve. And as a result, we've funded pretty broadly. We've done housing, social isolation, food insecurity, learning to use technology, helping older adults become more comfortable with personal technology. And transportation has certainly been a big part of that. Our funding tends to be a little more at the community level. So we haven't really funded, I can think of only one other grant that was a small one, that was technology development. We tend to, at least to date, have funded more in the implementation realm. And I think that, back to what Jim said, technology alone won't solve the problem. We've tended to fund solving the problem at the community level. And ITN really represented an opportunity for us to scale that thinking. And we know that transportation is a huge issue in communities. I should say too that Next 50 funds primarily in Colorado, but 20% of our funding can go out of state. So we're not a Colorado exclusive funder, hence the ability to fund ITN. What appealed to us about this proposal, it took us a while to kind of work through it and think, well, this is different. We haven't funded anything quite like this before, and to try to understand what the possibilities were. And the more that, Catherine is working her magic on me too, I must say. So the more that I'm involved in conversations with Catherine and opportunities like this, the more I see in terms of opportunity with this funding. The notion Dave talked about, a shared platform being something that can be available to every community, but that every community is different. There are similar needs, but they play out differently. And that was really appealing to us, that a lot of the organizations we have funded in transportation are relatively small. They serving rural communities. There are some more larger regional ones that we funded in Colorado. But the issues they're grappling with one-on-one are issues that I think the platform can help address. This whole notion of providing the infrastructure for organizations had a lot of appeal. And one of the things that Catherine and I talked about over the last few months is that the platform exists, the software exists, and it's in use across the country. And that had a lot of appeal to us because we funded some upgrades that grew out of experience with using the software in communities. And that notion goes to our interest in identifying what communities believe that they need and then trying to support efforts to address those needs. And this seemed like a great opportunity to do that, to help with some of the shared infrastructure back office needs that organizations have. We love that it's cloud-based, and so it's available to everybody. And that has some real appeal to us. So as we think about how Next 50 funds could and now will go to support ITN, we view them as an opportunity, or the grant as an opportunity to support ITN's work across the country. And that was the big appeal, and that led to the grant. But there's an additional benefit for us as a funder for whom this is new. And we haven't done it a lot of work in technology. Transportation we're more comfortable with, but it's an opportunity for us to learn. And that's really exciting. getting to meet some of you, and I'm really excited about the panel that comes next to hear about some of the work that's going on in communities. Will teach us things. We will learn about it. When we were reviewing this grant, we were thinking about some communities we know in Colorado that have struggled with transportation for years, literally, and still have not kind of hit on where to start. And I think that there are some resources here. The notion that ITN provides training and access to materials to help organizations address the issues that are common across the board, and then address them in a way that's locally appropriate, has a lot of appeal. And for Next 50 now to be able to participate in discussions at a high level and look at ways that the work we support can be scaled, can be a benefit to organizations we support in Colorado and across the country is very exciting. So am I saying exciting a lot? I think I am. And this is just that. I think this is a real opportunity for Next 50 as well. And we're really pleased that we're able to support this work, and we're looking forward to learning more as we do that. So thank you.
Thank you, Susan, very much. Thank you, Steve, and thank you, Earl. I think we're actually on track here. Everybody's speaking very succinctly, so we appreciate that for our listeners. I would like to introduce Alan Freed, who is our Information Technology Manager, and I like to say the brains behind ITN's software, and Morgan Jameson, who is our training manager, and she is the brains behind our community in the cloud and online training services. So I will turn it over to them, and they have some things to show you about the technology that we're all talking about.
Thank you so much, Catherine. It's a pleasure to be here speaking with you all today. ITN Rides 2.0 is the next generation software built upon the foundation of ITN Rides 1.5, which was built 20 years ago and upon which we have delivered over 1.3 million rides. What ITN does is to deliver a highly customized service, totally focused on the needs of our riders and the volunteers and communities who deliver those rides. Our affiliates stuck it out through COVID and are still out there in our communities, delivering rides to older people, people with visual impairments, and other people in the community who need a ride. I'm now going to ask Morgan Jameson, our training manager, to show you some of the basic features of ITN Rides 2.0.
Thanks, Alan. You all just heard Alan describing how our partners have used ITN Rides to deliver over 1 million rides. So what did Alan mean when he said they used the software to deliver those rides? So our software allows all of our partners to capture information about both the riders and drivers, to book rides, to assign drivers to those rides. In addition to that, it tracks and computes all of the financial information on the back end, which allows for easy implementation of those innovative payment programs Catherine mentioned earlier. And it helps make our community transportation services more sustainable. With the upgrade to ITN Rides 2.0, we've also introduced portals now for our riders, our drivers, and our business partners. We're going to take a look at those in a little while to improve communication and increase access. But Alan, that's not all that sets our software apart, right?
That's right, Morgan. Our software is different from others in that it is designed for communities to be able to customize their setup to meet the needs of their own community. Just as each ITN ride is customized to meet the various service and mobility needs of each rider, ITN Rides is customized for each community. Some of the key attributes of our application include the personal transportation account, what Catherine now referred to as the electronic wallet or digital wallet. This is the heart of our system. It's a flexible account, like a debit account, and it enables resources to flow in from various sources: volunteer drivers donating credits, road scholarships, sponsoring businesses and healthcare accounts, and credits from trading in an unused vehicle. So this account facilitates community connections with individuals, businesses, and healthcare providers. Beneath each contact record is a 178-field research database. Research is so fundamentally important to what we do and who we are. It moves the transportation field forward by supporting important research and also provides a revenue stream to help support the organization. Now Morgan will show a few of these features.
Thanks, Alan. ITN Rides 2.0 contains so many options for customization. What we're looking at right here is our settings screen, which shows some of the ways that this software can be customized to meet the individual needs of each community. As you can see, just on this page, there's a lot of different options. We're also going to go and take a look at a contact record. So this shows the information that we collect on all of our riders and our drivers, showing exactly that 178 field database that Catherine mentioned earlier. This in-depth information that we collect on all of our riders allows us to partner with government agencies like the CDC, but more importantly, it also allows all of our communities to access easily customized reports that allow them to better illustrate the difference that they're making in their community. You can see all of the different records. I'm just scrolling through them really quick, but that's a lot of information that we collect on all of our people. In addition to the basic rides coordination functions, ITN Rides also helps our community partners with things like fundraising. Here, we're going to take a look at how the software can track grants. So as you can see here, it can help our communities track their fundraising and their payments that are coming in through their community. So it's not just about the rides, it's about overall sustainability. And so Alan, how else does being on the Salesforce platform help our partners?
Well, you know, we did an exhaustive search for several years before determining that Salesforce was absolutely the platform on which we wanted to build our next generation software. Salesforce is stable, scalable, and secure on many levels. It protects the privacy of our users, and it has a huge ecosystem of support on which we can rely. Their philanthropic arm, salesforce.org, has also been a very important source of support for us. From the beginning, we designed the application to be accessible to differently abled users. There are 4 portals in the application for site staff, drivers, riders, and then businesses and healthcare providers.
This is our site staff portal that we're looking at right now. And Alan mentioned ITN Rides 2.0 is accessible by all meanings of the word accessible. We're going to start by talking about how we developed this software. We partnered with an agency that specializes in accessibility to design our custom screens so that they would be maximally accessible. Everything on this screen is designed with that thought behind it, from the colors to the sizing and the spacing, all of the fonts. They're designed to be easy for people who are low sight or colorblind to be able to access. Furthermore, the spacings and the screens are designed to decrease the chance of cognitive overload, and that makes the software more user-friendly. The web-based software also works with screen reader programs like JAWS. Now we're going to take a look over at our rider and our driver portals. Now drivers, riders, and business partners can log into their portals to access their accounts, request rides, and view their manifests on the go. Here's our rider portal where they can book rides. And then here's a quick look at our driver portal. So here's our driver portal, and our drivers are able to view basic details about their rides or click in to get a more detailed manifest that tells them all about their customers' potential special needs. In this page has been specially designed to be easily viewed on mobile phones. Back to you, Alan.
Thanks, Morgan. And so in addition to the portals, ITN Rides is connected to and supported by our Community in the Cloud online learning center.
Thanks, Alan. The Community in the Cloud, as Catherine mentioned, is my big project. That help and support we've built to be just a click away at any time that you're using the software. Here, you'll see there's an option to read help articles, and that takes you to step-by-step directions with screenshots for how to accomplish any task that you need to do in the software. Submitting a case will send a message to our help desk so you can get real human intervention to help you with any problems that you're having. And then now we're going to click over to our Community in the Cloud website. The first thing you'll see here are these are short YouTube style videos that allow anyone using the software to get a refresher on how to complete a task. We also have sections here on our Community in the Cloud website where communities that are just getting started, maybe they don't have a transportation service yet, but there's a group of people who would like to start one. They can access free tools to do that, and these are free to the public. They just have to sign up for an account. And then with our active sites, our partners that are working directly with ITNAmerica, they have access to a lot more courses on everything from our ITN programs to recruiting and retaining volunteers. And then we're continuing to work on building out our fundraising and marketing and other operations areas. One of the other areas that we'll be working for Community in the Cloud in the future is to build out our volunteer section, where all of our volunteer drivers will be able to log into the Community in the Cloud to access all different types of online courses for things like helping different types of special populations. And now we're going to turn it right back over to you, Alan.
Thanks, Morgan. We are so excited about this application and where we're going with it. Some features in our roadmap, some of which have already been supported by the Next 50 initiative, include an improved daily overview screen, making it more efficient for ride coordinators to do their job. An interactive manifest, so drivers can indicate in real time when riders have been picked up, dropped off, or did not show. This will enhance the safety and security of both riders and drivers. Increased interactive functionality for drivers and riders to use the application. This will make it easier for volunteer drivers to donate their time and enhance the ability of adult children and caregivers to participate in the care and mobility of their loved ones. An improved business and healthcare portal to make it easier to connect with supporters in the community and to facilitate these ride sponsors, making it as easy as possible for support to flow to riders and communities in the system. And provide more visual support for ride management, including a map view of each driver's routes and a weekly calendar view of all the rides. But what's really exciting is what we do. Delivering this highly customized service requires high levels of communication and management of details. It doesn't sound sexy, but together it delivers a system that is. Truly, all of these features support what we do, providing a really high quality of service to our riders, drivers, and their communities. Each of these pieces will make it more efficient and more sustainable for each group to contribute to the system. And the targeted support that the Next 50 initiative has provided, building upon what the Harry and Jeanette Weinberg Foundation and the CTA Foundation started, is the fuel we need to keep advancing what we do sustainably. And now I'm going to turn it back to Laura Lee. Thanks so much.
Hey, everyone. Okay, so now we are going to hear from the transit frontier, the people who are in the field using this transportation technology platform, and they're from all over the country. The first panelist is Karen Winton, who is a Deputy Director of Community Development for Kennebunk, Maine. She is involved in social service, planning, and economic development initiatives for the town, including transportation projects such as the ITN Country pilot project, The Connector. Karen?
Great, thank you. Well, first, I want to say another thank you. I don't think it's often that you get to see a lot of the people that support the work that you're directly involved with financially like this. So to the people who have done that for ITN, I certainly want to thank you, and I'm glad to have this opportunity to share a little bit about our experience here in Kennebunk, Maine. We are one of the pilot sites for ITN country, and I think I heard Jim say during his conversation, government can sometimes, I think he said, mess things up. I know what he meant, and sometimes we can, and we don't want to do that. What we're looking for is to help people, and we're public servants. We're looking to help our citizens, and how we do that is by really trying to understand what their needs are, connect them with resources, and then support those resources that are available. So our particular community happens to enjoy a lot of older adults, and looking for ways to support them. ITN country is one of those ways we can do that. What we need to do that as a municipality is a lot of information that helps our citizens understand why this is important. So we operate with taxpayer dollars, we're responsible to our taxpayers, and we have to share with them what we're doing with their money and make sure that they believe in it and want to support that too. So how we do that is by telling a story in terms of providing them with information that they can understand. When we were first approached by ITN to participate as a pilot site, it initially seemed a little overwhelming. A lot of municipal staff wear multiple hats. We have to really be able to plug in and do a lot of different jobs. And initially, this seemed like a large output of staff resources. So what we really needed was that efficiency that Alan just mentioned. And when we saw and understood what the software was going to do, we knew this would be possible for our town. So when we look at the software and everything Morgan and Alan just went over and talked about, the information that it gathers for us, keeps for us, that is what allows us to tell the story to our citizens, to our governmental leaders, and encourage that support of programs like this. One thing that I think is really interesting about a town is we're not always so great about being hands-on operating all kinds of programs. But when you have something like this, where it's a matchmaker for you and you're just pressing a few buttons and being that friendly go-between, it makes it really easy. And we're looking to encourage other municipalities to join our efforts and participate along with us. And what's great about ITN, again, is it's so transferable. It's a model. The software allows you to just plug and play as another municipality. So it could really grow a lot of legs. We're looking for it to do that in our area, certainly, and bring other people to the table to include them in the conversation. We just held our first ride for this program last week. So I'm really briefly just going to show you a picture that's probably a lot nicer than looking at me here. And if you can see that, that's our first rider and our first driver last Friday going out to get a haircut and stop at the hardware store. So this was really exciting for us. And along with data, photos tell a story too. So I made everyone pose for lots of pictures and do that, and they did nicely. So we're really excited to be participating in this, really excited to connect with those that are supporting it and provide that point of view of a local government in a way that we can contribute positively to these policy changes that need to happen, these programs that need to be in place for our citizens, especially given the unique characteristics of our community. We do want to be that partner, and tools like the software and all the support that we're getting, it's just, you just put the hat on and you get to wear it. It's easy, just like that. So we're thrilled to be a part of it and thrilled to be a part of this conversation. Thank you.
Thanks so much, Karen. The next panelist is Trayvon Jacobs. He has spent more than 25 years in the nonprofit sector, aligning his personal purpose with his profession. His passion for addressing issues facing the underserved led him to ITN Gateway. Over to you, Trayvon.
Well, thank you. Thank you all for attending today. You know, for us, when we have the opportunity to speak to the community and they ask what our ITN Gateway is as an organization, the initial answer for some folks that they come to themselves is that we're a transportation organization. And I say, no, we're an organization that saves lives, and we use transportation to do that. You know, as we deal with life as it stands today in relationship to COVID and everything that's come with it, even as it goes to gas prices, there's some hard truths that we need to tell ourselves and need to face. Those hard truths are isolation leads to death. The digital divide is more than a socioeconomic aspect as we work with seniors. Time management is needed today more than ever because staffing has taken a significant hit in every way. And there's still a place for us to do our daily mission in saving lives. 2.0 allows us to touch some of those aspects and use it as a tool. When we think of how we work with the community, we try to find those avenues to do so. And 2.0 allows for family members. And I don't want this to be redundant because Alan and Morgan touched on them, but to have family members be able to get online and book their parents' rides to dialysis, to have them book their cancer rides, to set up a recurring payment within the system while they live out of state is something that's needed because the time for the phone calls that were there pre-COVID doesn't exist. Since COVID, we provided more than 22,000 rides here in the Gateway area. And the time that it takes to facilitate that from the back office to the actual rides is something that's significant. And now we're down on staff. We were staffed up to 3 full-time staff members, and we don't have that. Even as the executive director, my day started off with me taking 2 individuals to dialysis. If I'm not there, they don't go. They're both in wheelchairs, and we have only 1 wheelchair van. So being able to provide those rides is something that's definitely needed, but for those family members to be able to pay the bill, book the ride, and know that we have it covered is a comfort that they can have every day. Here in the office, for our staff, as it relates to the amount of back office work that goes into paying for rides, distributing scholarship dollars, and things that are needed, 2.0 gives us the tool to be able to do that from a time management standpoint with the integrated payment system. Being able to have someone get online and make a payment and go, it allows to filter down the number of phone calls or messages that need to go out that we do by hand. It allows us to be able to communicate with family members on that level as well, for them to send us messages. Today, we had one of our first members, I think Barb May is just about 87 years old. She booked 2 one-way rides, one to go get her hair done and the other to go to a much needed doctor's appointment. She's going to get a ride home with a family member that's going to meet her there, but she was able to do that herself. She went from the process of getting a welcome email to getting herself set up on the portal, booking her ride and waiting on us to accept the ride and assign a driver. We did that, but because it's still new, we went ahead and gave her a call, and her first response is, it's already taken care of. That was comfortable for me in the other room to hear that on speaker, to know that the tools that we need to save the lives, and I won't stop short of saying that, to save lives is at our fingertips. To know that the digital divide is there outside of, like I said, the socioeconomic standpoint, but one that is in generational gaps. We can play a role in that while not being trapped in the box as a transportation organization. We can walk them through the process of setting up their accounts and being able to book their rides. For folks that's never done it before, but as we all know, we've given the tablets, we've set up the computers as Christmas gifts, hoping that they'll get the pictures of grandkids and things of that nature just a little bit faster. Well, now that tool that you put in the household to add comfort is also a tool for them to live the day-to-day life that they should be able to live, which is getting out of those 4 walls. Our goal is for them to live the life that they've always led since the age of 18, some even 16, being able to provide transportation for themselves. Here in our office, again, when you have such a number of rides, and right now we're still averaging about 45 to 50 rides a day, it's a toll. And so assigning drivers in realistic time is something that we deal with. Even this week, we had a driver exposed to COVID, and our policy is we take that driver out of the framework for 5 days and allow them to pass a COVID test, but reassigning rides. The system will allow you or give you the assistance of being able to put drivers on rides that are financially close to them and logistically close for them. Because occasionally you'll have a driver that will drive a number of miles for a 1-mile ride. Now, part of that is the engagement, the relationships that you share with folks. We have someone that will only squeeze in or can only squeeze in about 30 minutes But in this featured program where we can send out an uncovered rides manifest, if you will, to all of our drivers who hasn't signed up for driving today, but know that we have an SOS situation, they're able to look at that list of uncovered rides and say, you know what? My connection with Marilyn Goodman is one that I can carve out that 20 minutes and take her. I can see the ride. And on the other side, say, I don't know who Mary Harrison is, but I'm in that area. I can go pick her up and drop her off, and that would save them the hassle. But at the same time, I'm feeling that need. The one thing that we found coming out of COVID is that we had volunteers recognize that we were also saving their lives. DJ, which is one of our drivers, she said, guys, I miss driving more than I think the people I drove. Having that personal day-to-day something to do is the tool that we're looking for. And so being able to connect from a technology standpoint, what we do hands-on is the key. The need for, as Jim said, the financial aspects to not only support the development, but the continuation of software is needed. We can't build the building and not build the break room. We can't build the building and not continue to add on to the parking lot, because our mission is one that only grows. And so while we sit in Gateway and we're doing rides both in St. Charles County and parts of St. Louis County, we want to be able to use this technology in 2.0 to allow both our riders and our volunteers the opportunity to do what? Do more while living a life filled of both service and activity. And as we look at that, 2.0 allows us as the staff, the third component, to be able to do just that. Again, I can go over many other things, but I think it'll be a little bit redundant as it relates to Alan and Morgan. But what I would say to you all, on all aspects that we come together today, is to feel encouraged, to know that we have a tool to save lives. I often tell the folks, no, we don't have an advanced degree in medical terms or an advanced degree as it relates to sociology or psychology, but being able to put boots on the grounds with the tools to be able to get people where they need to go in a time that we actually saw over the last 2 years is needed more than ever. The need to be able to be part of something bigger than yourselves and the need to get out and be around folks just as yourself is something that we play a role with every day. And 2.0 just makes it that much easier. Thank you, guys.
Thank you so much, Trayvon. Okay, so the next panelist is Carl Wellborn. He's the Executive Director of Independence Rides and ITN Country Community in Greater Detroit, Michigan. Carl spent 34 years at General Motors, leading advanced transportation development teams in design, engineering, and research and development. Over to you, Carl.
Hello to everyone. Thanks for being here. Can you hear me okay?
Yes.
Yes. Okay, great. To keep it short, our major focus here at Independence Rides is to address a somewhat unique situation. I know every area has its unique situation, but for Detroit, in the Detroit area, as many of you know, vehicles have been historically much less expensive and much more plentiful here than just about any place else in the nation. So because the automobile has had such a central, both central impact to both lifestyle evolution and infrastructure development in the region for over 100 years, public transportation systems here are, we'll just say, not so good. So therefore, our long-term goal, especially as was mentioned before, aging is a growing problem and will continue to grow for quite some time. Our long-term goal is to develop a system that will be effective in serving across urban areas, suburban areas, and rural communities based on the ITN country model. And the flexibility that I'm seeing with 2.0 is proving to be quite useful in achieving that goal. For instance, while we've been on the new platform only for a few weeks, we're already being able to use the data, manipulate the data in ways to allow us to run a number of ride scenarios, organizational scenarios that we haven't got set up yet, but we can look at those scenarios very quickly, because the software is allowing us to manipulate that data easily, much more easily than the older version. So I think I can say that the software is going to be a great shot in the arm for us in terms of the unique nature of the communities that live in the Detroit metropolitan area. And this is in addition to the other organizational enhancing features that have already been mentioned. So though we are very new and very small, we see ourselves as playing a significant role in addressing the, I'll call it the wide variety of transportation challenges affecting so many seniors and people with disabilities in our area. And I think 2.0 is going to be a key enabler in that effort. Thanks.
Thanks, Carl. Okay, our last panelist is Herb Pettigene. He's a volunteer driver and a steering committee member for Woodford Wheels, an ITN country program serving Woodford County, Kentucky. After teaching science and math at the high school and college level, he joined the Kentucky Department for Environmental Protection, and he retired in 2019. Go ahead, Herb.
Okay, thank you. First, want to apologize if we lose connection. I've been having some problems with our internet provider today, but hopefully I'll get a chance to explain some of the reasons I'm really happy with this software. It's really a great thing. Woodford Wheels is currently in its soft opening phase, which is progressing well, and we're looking towards a formal launch probably next month. Now, as noted I'd previously worked for the state, and what I was doing was helping with abandoned properties that might have environmental issues. So doing assessments, cleanups if necessary, and trying to get them put into some sort of beneficial reuse. But a lot of my time was spent dealing with filling out databases and generating reports. And, that was essential because you got internal program management, fulfilling federal grant requirements, and when you go to apply for additional funding. But it just seemed like so much of my time was spent doing that instead of actually going and revitalizing these properties. So when I signed up as a volunteer driver, my expectation was, okay, guess I'll have to keep a logbook and write down all the mileages and things like that. And so I kept during the training asking, okay, what do I have to record and stuff? No, surely I've got to record, but no, actually, the software has been explained, it does all the stuff, once you got the driver and rider in, you put in the destination when they need to be there. It figures out times, routes, distances, all that stuff. So, and then it generates a manifest, which can be provided to the driver that provides them that information, plus any special assistance that the riders may require. So that's gone well, and I anticipate probably when we get ready to do our annual report, having all the ride information and all the financial stuff in one place should make that fairly simple to generate some comprehensive, insightful reports. And as I noted, you need that for program management, for providing information to your existing funders, and then as you're going out and seeking additional funding. Now, there's been some bugs, and our ride coordinator has been working with the program extensively, both during the sandbox trial area and then in real world use, and has been very pleased. And she's been passing things on to the programmers to address bugs as she identifies them, but again, very pleased with how it works. As a driver, I've only personally worked with the driver portal and still familiarizing it with the stuff that's available. works pretty well. But one thing I notice is that, the view manifest button is somewhat hidden when I try accessing it on the phone. I imagine it probably is in a prominent place on a laptop or desktop. But, this is something all programmers have to work with, is trying to fine tune something so it works against all platforms. But overall, very pleased with how the system's been working for us here in Woodford County. So in conclusion, I just want to say I'm so delightful. I'm not spending my retirement filling out spreadsheets, but rather, spending that time helping neighbors. That's what I want to be doing with my retirement time. And the software enables me to do that. So thank you.
So shockingly, we are on schedule here, and we have time for a summary and then to take a few questions. So just a sort of a quick overview. We started with Jim Firman talking about scaling in general and scaling technology and nonprofit technology. Then we heard from Earl and Steve and Susan about why their foundations decided to jump in and participate in a collaborative effort to fund technology that communities really across the country can use. So no one foundation funds the whole project, and each foundation, when they participate, builds something that is bigger, more expensive, and serves more people than their foundation alone could support. And then we heard from Alan and Morgan, and they showed us some of the features of the technology and the online learning center. And then we heard from what we call the Transit Frontier, which was from Karen and Trey and Carl and Herb. So this event has been way too fast to be participatory. I just want to tell folks we have a number of different kinds of organizations and people participating today. Thank you all for joining us. We have a number of foundations and a number of community organizations, government organizations, and individual people representing transportation services. There will be another national event, October 12th and 13th. That'll be our national, we've always called it our retreat, and that'll be participatory. And if you've participated in this event, we'll be sending you information on that. So apologies for not being very participatory today, so that we could do our speed dating version of getting this information to you. There will be a participatory event coming up. I think we do have some time to take one or two questions. And I just am not sure how I'm going to do that, where those questions are. Do we have some questions, Nicholas, for our panel to address? We have no questions. Okay. Well, but I can tell you this, that almost every single person who joined this event stayed until the very, very end. So I think maybe the speed dating version is good, and we didn't have Zoom fatigue here. If any questions come in, we will take them. I want to say a word about if anybody wants more information about ITN Country, you can go to the ITN Country website and submit your inquiries there, and that's itncountry.org. And for those foundations that are participating, if you're interested in helping out with what we're doing, I certainly hope you are, then you can reach out to me. Nicholas can put a slide up for us on contact information, can reach out to me to find out more about how you can participate in this collaborative effort. And there's my phone number. And there's Laura Dake. She's our project manager for ITN Country. If you want to learn more about ITN Country, ask questions, or just learn more, Laura will be happy to help you. And it looks like a question might have come in.
Well, we have a person that raised their hand. So if you wanted to speak, Nora. She took her hand down, so.
All right. Let's see. Does say that Nora has a question. So if you're there, Nora, if you're trying to unmute yourself, maybe Susan can help you.
No, I'm good. Can you hear me?
Yeah.
Hi. Great update. I just wondered about, so, you know, we proudly supported ITN early on, and, you know, I appreciate Jim and his conversation around, you know, in order to navigate and be a successful model, you go through a lot of major learnings. And so I just wondered about metropolitan areas like a Boston, where getting access to drivers was a problem. And I just wondered if that had ever been addressed or resolved, or if there was an evolution around how to address, not only through COVID, but certainly through just normal times, the whole issue of volunteers, since it is so volunteer driven.
Let me see if I can take a shot at that. We found that this model, the ITN classic model, did struggle in highly urbanized areas. And I think that a major part of that reason is that people who volunteer to drive do it to help others, but they also do it because it's a very positive personal experience for them. They enjoy older people, they enjoy driving, they like having conversations, they like the social interaction. And when you're driving in an urbanized area, it's quite a different experience. And so I think primarily in the higher density areas, that's more of an environment where you need to pay people, because that's not the kind of social, relaxed engagement feeling. Now, 3 out of 4 older people in this country live in suburban and rural areas, so that leaves a lot of older people to serve. So a very dense population in the urban areas, but it's not necessarily predominantly older people. That said, there are other differences between the original ITN model and the ITN country model that we believe are going to make ITN country more adaptable to the urbanized areas. So even though it's called ITN country, Carl Wellborn, for example, in Independence Rides in Detroit is in a more urbanized area. So I think that some of the key differences between the two models are ITN had to be a separate 501c3. That's the ITN classic model, and it still is. That's Trayvon Jacobs. He's executive director of a classic ITN in the St. Louis area. And you have to charge a fare, and you have to provide a ride 24/7. With the ITN country model, there's an enormous amount of flexibility in many areas. It can be a program with another organization. You may or may not decide to charge a fare. You can set your own hours of service. So the ITN country model is designed to be very adaptable and very flexible, so that in an urbanized area, for example, if you started an ITN out of a church or out of a neighborhood organization, then your volunteers could work with your local management, and they could provide the service when they are willing and able to, and you wouldn't have those kinds of pressures to do 24/7 service for any purpose, no exceptions. So I hope that maybe is helpful to you.
It did. Thank you very much. It was
okay, good. Okay, good, great, thanks. And I think Kristen LaPraza has a question.
This might be a question more for Alan, but I was just curious, this being kind of your newer update of technology, if you had planned, I guess, updates or reviews that you have in mind, because technology changes so fast and what we have available today won't be available, or won't be the most available technology in a year or 2 years. Do you have planned updates for this, and how adaptable is it for future technologies, I guess, for that kind of viewpoint?
Well, yeah, thanks for the question, Kristen. So I guess there's a few different ways to take on that question. As well, many of us know, and Jim Firman spoke about this, technology development never ends, right? Software is never done. There are always new technologies and new needs and, feedback from people and, AI and all these different things. It's always a fast moving environment. And so we understand that very well, and that, technology development needs to continue. We do have a short to medium term roadmap. And beyond that, it's still in development. And what I have to say too is that it is very much dependent on funders, right, and funding. And as we look at what our needs are going forward with the technology and what the community's needs are, and we reach out to funders and put grants together, that's where there's kind of a marriage between the roadmap we have and what we can actually accomplish on the ground and what we can get funded. We absolutely expect to be sort of forever improving the software and incorporating new technologies and listening to people on the ground and in communities in terms of what the priority needs are. And so that's, I guess that's how I would answer that.
Okay, thank you.
Great. Looks like we got another question in the chat from Don, who asks, in what ways is your model different from Uber? What role does Uber play in senior transport? And what role can it play in the future? Thanks for your time. Catherine, you want to take that?
Sure, I'm happy to try and answer that. So 70% of the rides that Uber and Lyft provide are in 9 cities. That's a business model that must make a profit. And as you probably know, because it's in the news all the time, they're not profitable yet. And so they need fast-paced rides. They need short distances between those rides in order for it to be profitable. As I said when I was speaking with Nora, older people live in more suburban and rural areas where the distances are longer. And so it's not as profitable for Uber and Lyft to be doing rides for older adults. There's a lot of promotion for them to do those rides for healthcare, but I haven't seen the data yet on how many of those rides they're actually doing. There's a lot of promotion for it. But when I did a report with the University of Chicago, funded by the CDC, on all senior rideshare in the United States, and at that time, which was about 4 years ago, only 4% of Uber and Lyft's trips were for people over the age of 65. So I think they're not serving that many older people now. They're a very good model for people in highly urbanized areas. Most of their riders are between the ages of about 25 and 50. So I don't see a big role for the for-profit transportation network companies for transportation for older adults. We filmed a video recently and we were in front of a supermarket, and while we were there, I noticed a woman leaning on her shopping cart and playing with her smartphone a lot. And I finally just turned to her and said, "Are you waiting for a ride?" And she said, "Yes, I'm waiting for my Uber." She said, "Do you know, I took my ride here and I don't know why it was surge pricing. It cost me $25 to get to the supermarket." So I don't know about you guys, but for about $35, I buy a week of groceries. So that's a very expensive ride. And then she was waiting for her ride home. So I think the nonprofit services, the kind that can use this platform and can serve older people, the kinds of things that Trey was talking about. Those are the kinds of rides that these services provide. I still drive on Sundays. The ride I do at 7:30 on Sunday morning is for an older adult with dementia going to an Alcoholics Anonymous meeting. You know, that's not what we think of as senior transportation, but she was safe, she was happy. So it's really quite different. That's my 2 cents on that. Is there another question, Nicholas?
Yes, looks like Bethany, you have your hand up. You can feel free to speak.
Yes, we currently have, we use a ride scheduler program, and we've got several people that do ride on these rides, and they do it for free. And we were just curious if this particular program, if they charge the seniors for their ride to and from appointments, or if it was a free service.
Good question. So the answer is that every community decides for themselves whether they want to charge, and if they do want to charge, how much they want to charge. So the original ITN model, you pay for rides, but this is ITN country. So what we did was we wanted to share with the world, with the country, what we learned about building a community-based sustainable system, but we left behind the idea that everybody has to do it our way. This was very hard for me to say that I didn't have to be right all the time. Yeah, I think it's easier to have a baby than it is to say you've been wrong, but I don't think we should tell people what they should do. And so ITN country takes everything we learned about community-based services for seniors and for people with special needs in transportation, and makes it available to each community. So Bethany, if your community provides transportation, but you don't charge, you can absolutely use this platform. And you could, for example, if you're on the platform, you could say, listen, we're going to try charging and see what happens. You could do it for a while and see if it works. And if you like it, you could keep it. And if you don't like it, you could get rid of it. You can decide you want to provide service Monday through Friday, and then you can try weekends. And then if you don't like it, you can get rid of it. You can really create your own solution. The platform will support that, and you can change it and evolve as you go. And I think, you know, good solutions change and evolve as they go, not just the technology, but the service delivery and the people who are running it. So I hope that answers your question.
Yeah, and then the other thing is we're in an urban area because we're in downtown Charlotte. And so so I was listening to what you said about the urban, sometimes it's harder for the urban areas, I guess, for them to utilize this program effectively.
No, I think that if you're providing service in Charlotte, we'd like to know how you're doing that. That's really interesting. But if you're getting people to volunteer in an urbanized area, you can absolutely use this software in that urbanized area. It's not, you know, you have to separate the delivery model from the technology platform that enables you to deliver that model. So if you're doing volunteer transportation in downtown Charlotte, you can absolutely use this. If you don't charge for a ride, you can absolutely use this.
Okay, great. Thank you.
Okay, sure. Yeah, you're very welcome. Do we have any more questions? We're actually at 12:29. Looks like there's one hand up. Oh no, that's Bethany. Okay.
We have a question from Trey.
We do? Okay.
I just wanted to say one thing to add on to everything that Catherine said that I think goes to the last two questions as it relates to what's different between us and an Uber, as well as working in an urban area. We're door through door. To be able to get someone inside of a building in a waiting area, and then to come back and go inside to get them. Uber, Lyft, and everyone else is not going to do that. When you're dealing with different regions and you have, today it's 101 degrees. All of my riders will be sitting inside of an air-conditioned building, and my drivers will go in and get them. That's one of the most intangible differences of how you can succeed in an urban area. For someone to know that mom is safe, for dad to know that he's not going to fall because someone's going to walk him down that curb that seems to be just too high, is a big difference. For the volunteer, that's the difference even for them. I'm doing more than just driving. I'm making sure they're getting in and out. I'm making sure that in that big building, they're getting to suite 304, which is where they need to go. Door through door is the intangible difference between the regular ride service. I just wanted to add that one point.
Thank you, Trey. I love your passion. It's wonderful. Thank you. Let me add one thing to what Trey has said, and then I think we'll wrap it up. I just returned from a conference in California on autonomous vehicles, and I think it's very important to remember that technology does not hold still, and that it offers opportunities along the way, but that we have to have people do the things that people need to do, and the technology has to support the people. So with autonomous vehicles as a key example, I think the role for volunteers is never going to go away. As Trey said, you have to go inside and get the people. You have to help them with their packages. You have to offer an arm over an icy sidewalk. You have to help people fold their walkers and get into the vehicles. And technology doesn't do that. It is people who do that, and people who provide that kind of reassurance and help for riders. I think that the role of nonprofit, community-based volunteer transportation is destined to grow in importance as the population ages and even as technology develops. I think there'll always be an important role for people. So let me bring this to a close then, and thank you all so sincerely for joining us here today for the third Philanthropic Collaborative for Transportation. Here's our contact information. Please reach out to us if we haven't answered your questions, any questions at all. And please reach out to us if you are interested in helping us scale this solution for older adults and people with special needs across the country.